Hi everyone, this is Dr. Kim. So I'm going to take you through this case. This periapical radiograph was referred to our clinic from outside March of last year, 2019. So take a moment to evaluate this PA. Pay specific attention to tooth number 3 and its surrounding bony structures. Alright, so that was in March, and after clinical examination they decide to do root canal therapy on number 3. So let's go through a series of periapical radiograph during the root canal therapy. So here's number 3. Clearly we see periapical radiolucency, and there's another view of number 3. Here we have files to establish working length. Looks like this is the one with the gutta percha or the master cone. And you can see a little bit of sealer that came out through the APCs, and based on this appearance, looks like they found both MB and MB2. Another view of the completed root canal therapy. Okay. So that was these radiographs were taken in April. Fast forward to January of 2020, right here, and that's how patient presented after almost 8-9 months later. What do you think? How is the surrounding bone appears? Do they look healthy, or do you think there is a lesion at the apex? And if so, how big do you think that is? So I want to show you a couple more radiographs taken in January. Right here, here's another view of that radiograph. Here's another. Again, we can see MB and MB2. Here's another view. Okay, so what would be your assessment? And if you think there's an issue, how big is the lesion? Now, I'm going to show you cone beam CT of that patient. So here's tooth number 3. That's the axial view, coronal view, and the sagittal view. I don't think there's any debate at this point that there is a clearly well-defined, relatively round periapical radiolucency encompassing the mesiobuccal root as well as the distobuccal root. So let's scroll through the axial view to visualize tooth number 3. MB, MB2, distobuccal and palatal canal. And there's that periapical radiolucency. Let's look at that in the coronal view. So here we're sectioning through the mesiobuccal root. Let me see if I can bring those two canals better. So here's mesiobuccal, and that's the MB2, which merge in the apical third and exits as a single canal. And now let's take a look at distobuccal. There you go. So that's the distobuccal canal or the distobuccal root. Let's also take a look at palatal canal. There it is. Now, why don't we evaluate the overall extent of this radiolucency? you pay close attention, we see this boundary or this border, and hopefully you can you know this by now, that this is a floor of the right maxillary sinus. So the lesion extends to the floor of the maxillary sinus, and at least to me it looks like it has caused a disruption along the floor. I can no longer follow the cortical boundary of the floor, and right over here. Again, it wasn't something you could clearly tell on periapical radiograph. In addition to that, although we have just partially captured the right maxillary sinus, we can see that that there's a rather moderate to severe mucosal thickening along the floor of the maxillary sinus. You can see this border right here. So this mucositis is probably most likely related to this periapical infection. And that would be my guess, given the proximity and how it has caused the perforation of the sinus floor. I would expect this to have caused inflammation of the sinus lining. And I think the main point is I want you to once again appreciate how much more information cone-beam CT can show versus the periapical radiograph, where you were guessing the exact border of the radiolucency. Perhaps you didn't even recognize that there is a periapical radiolucency. And so it's extremely helpful in this case for endodontic residents or endo residents to figure out where the issue is. And I didn't spend a whole lot of time going through the palatal root, but I think palatal root looks okay to me. So it's just the radiolucency involving both the buccal roots. If you look a closer look at the palatal root, you do see that there is a kind of radiolucency around the apex. Once again, if you look at this coronal view, there is a radiolucency, but yet it is filled with bone. So what that tells me is this was probably the original outline of the periapical radiolucency, and after the endodontic therapy, that this area has healed now and remodeled. However, it did not fully achieve the bone density of the adjacent bone, which is quite sclerotic to begin with as a result of inflammation. So I don't think there's any active inflammatory process going on along the palatal root, but just the two buccal roots. So at this point, the resident has a choice of either redoing the root canal therapy or doing a surgical, approaching this surgically, doing apicoectomy on both of the buccal roots. And if I understand correctly, that the resident is planning to do apicoectomy of these two roots. So I hope this was interesting. And if we look at the 3D rendering view, there's that mesiobuccal, distal buccal, and filling material within the palatal canal. And as I rotate, you can see how the MB2 canal joins the main MB canal. Thank you very much, and I'll see you in the next video.